Hello everyone, and thank you for attending this presentation. My name is Stephen Hall, and I'm a registered nurse and Master of Nursing student at the University of Saskatchewan in Canada. Today I'm going to be sharing the results of a scoping review entitled Cancer Caregiving, a scoping review of caregiver-identified priorities for support. In preparation for an upcoming study to set priorities for support services in Saskatchewan, Canada, we wanted to get an idea of what existed in the literature regarding engaging caregivers in similar activities. For the purposes of this study, we focused specifically on caregivers to older adults. We used Arksy and O'Malley's methodology to conduct a scoping review of the literature. Our inclusion and exclusion criteria are presented on the poster. We included a total of 34 studies in our initial review. Although the initial scoping review included studies that engaged caregivers to all conditions, there were 6 studies that focused on caregivers to older adults living with cancer. During our analysis, we found that there were unique experiences shared by cancer caregivers. It seemed warranted to conduct a sub-analysis of the 6 cancer caregiving studies. The table of themes, aims, and priorities identified for these 6 studies is also presented on the poster. In both the original review and the sub-analysis, we used content analysis to sort codes into categories, which we consider to be the overall priorities of caregivers. We ranked these categories based on the number of codes in each category to present a synthesized list of caregiver-identified priorities for support. For our sub-analysis, we found that there were 5 priorities important to caregivers to older adults with cancer. Caregivers want to be orientated to their role. They want to learn how to juggle life and caregiving, and how to be available to their care recipient when needed. They want to learn more about their care recipient's cancer diagnosis and start to prepare for the future, which may include preparing for the end-of-life experience. Caregivers want to be engaged in their care recipient's cancer care, which encompasses assistance in navigating the complexities of the healthcare system. Part of being engaged in their care involves receiving care themselves, as they feel as though healthcare professionals should be assessing their wellness in addition to the care recipient. Cancer caregivers want to learn about self-care, how to make time for themselves, and how to cope with their care recipient's needs and cancer diagnosis. Access to Respite is where caregivers reported needing better access to resources and learning how to accept help from others. Lastly, financial assistance and policy reform to address the needs of caregivers is a priority that was reported within the studies. This sub-analysis presents a synthesized list of cancer caregivers' priorities for support. Our synthesis can be used by policymakers, healthcare professionals, and organizations to guide decisions when developing support interventions and services for caregivers to older adults with cancer. Thank you so much for attending this presentation. Stay well and take care.